Today I'm going to be going over all of the post-op instructions for the facelift procedure. This is going to cover everything that you need to know for your aftercare and what we expect you to be doing at home after your procedure. So first thing is your little care package here that you will get from us. I'm going to go over everything that's in here. So first thing in here is Dr. Frankel's card. It has his cell phone number on it. He likes all of his patients to have this. If you have any issues, questions, or concerns after your procedure and you can't reach us at the office, and it may be after hours, you can call or text him there. Next thing is arnica. It's a natural supplement for bruising and swelling. So with the arnica, you do get this little colorful piece of paper that has your directions on it inside your care package. So you're going to take it starting the day after your procedure, 2 tablets 3 times a day. So that's 6 tablets a day you'll be taking. They're just little white tablets. They put them underneath your tongue and they dissolve. Now, the supplement is for bruising and swelling, so as you can expect, you will have bruising and swelling after your procedure. Typically getting the worst around day 2, day 3. Everybody is different though, and then from there, it does gradually start to get better. So have great results with this with patients, get good feedback, so definitely encourage that you take this afterwards. Next thing, ice packs. So with the ice packs, these are just reusable ones. They have the cloth on the one side, so we do encourage you to ice after your procedure. Our only rule with icing is that you ice 20 minutes on and 40 minutes off. So you can apply this, directly to your lower face, your neck, wherever it may be comfortable for you. It does help with swelling, and it's just comfortable for patients as well. So most effective for about the first 3 days after your procedure, so we do encourage that you ice during that time. Next thing, probably the most important thing in your care package, is going to be bacitracin ointment. We give you these little packets, and then we just give you a travel size Q-tips to apply it with. So with this ointment, this is going to be most important for the first week after your procedure. So your job is going to be applying this ointment 2 to 3 times a day on your suture line. So the goal is just to always make sure that you have something on your sutures so they're staying nice and moist, and it helps with the sutures to dissolve, also helps with healing. So you won't have to do this starting the night of your procedure. You'll have to do this starting the next day after your bandage change. And when you come in for your bandage change, we're going to take off that big bandage that you have on, and then you'll be able to see all your suture lines, and we'll also review it in further detail with you there. But just so you know what to do with this inside of your care package. And then the last thing in here is going to be baby shampoo. So with the baby shampoo, we do clear you to wash your hair 2 days after your procedure. Now, most patients are not comfortable at that time, and that's okay. Whenever you're ready, it's at your own pace. Our only requirement is that you only use baby shampoo. So we just don't want the normal chemicals of shampoo and conditioner by your suture line. So with the baby shampoo, it's totally safe to use this around your sutures. Our only thing is that you shouldn't be excessively pulling or tugging your hair in certain areas by your sutures. It just puts a lot of extra tension. And then another big question that we get is, can I get my sutures wet? Absolutely. It's good to get your sutures wet. It helps them to clean them. And then it also, when you get out of the shower, just make sure that you're kind of drying the area, and then you should be reapplying your ointment because it probably came off in the shower. So then the next thing you're going to receive from us is your actual post-op instructions that has all kinds of information in here for you. I'm going to cover some of it. Everything I just went over in terms of the daily care is also going to be in here for your reference. We tell patients, make sure you're looking it over, familiarizing yourself with it, and then if you have additional questions, we are here for you. So just some things to touch on that you should be avoiding after your procedure. So we also give you in your goodie bag green concealer. So you're not allowed to apply makeup for the first week afterwards, which most patients are at home, they're recovering, so they're not going to be putting on makeup anyhow. However, once we see you at 1 week and you can start applying makeup, you may have some residual bruising lingering around. So we give this green concealer to patients. It's great. It can cover up any lingering bruising. Green helps to cancel out any redness. So what we tell patients is that wherever your bruising may be, you just put some of the green concealer on, blend it in, and then if you have like a concealer or a foundation of your own, you should put that over it, and it really does help to conceal the bruising that you may have that you want to cover up. Next thing, coloring your hair. Shouldn't be coloring your hair for 4 weeks after your procedure. So get it done right before, get it taken care of, and then you don't have to worry about it afterwards. But if you do need it done afterwards, you do have to wait 4 weeks. Driving after your procedure, you should not be driving for 7 days afterwards. Now, we say this because if you're going to be taking the pain medicine or the sleeping medication that we prescribe for afterwards, you shouldn't be driving while you're taking those. But also, when you're driving, that kind of excessive motion of turning your head side to side, we don't want that extra tension on your suture line, so we say no driving for a week afterwards. Now, in terms of your sutures, we will see you at 1 week for your suture removal. Most sutures are dissolvable. In fact, most will be dissolved by a week, but some will be in place. So we'll evaluate where you're at and we'll take some out, we'll leave some in place, just depending where you're at in the healing process. Now, activity wise, you shouldn't be lifting anything heavy. We don't want you, bending over, dropping your head below the level of your heart rapidly. Activity level, not saying we don't want you doing anything after your procedure, but you cannot be doing anything strenuous for the first 4 weeks after your procedure. So strenuous means raising your heart rate, raising your blood pressure, getting you out of breath. So you shouldn't be going outside and running 5 miles. But just to give you an example, so maybe the first week after your procedure, you should only be doing things around the house. So getting up, walking around the house, light things around the house, that's okay. We do want you up, moving around. Maybe the second week, you could go for a light walk outside if you're comfortable. Third week, maybe a gentle hike. And then the fourth week, if, maybe getting on a stationary bike, maybe getting on the treadmill, and just you're really gradually increasing your activity again. You're not, going from doing nothing to going right back to your normal activity level. You want to allow your body that time to heal. With the sun, depending, what time of year it is, you don't want any direct sun exposure to your face after your procedure. Now, another important thing is sleeping elevated. We do want you sleeping elevated at least 30 to 45 degrees. So, 2 or 3 pillows propped up behind you. If you have a recliner or a chair or something to sleep in, we just want you nice and propped up. It does help with swelling and also helps to keep patients comfortable after your procedure. You'll get all of this stuff from us, but if you still have any questions after reviewing this and your post-op instructions, we're always here for you. You'll also hear this stuff from us at both your bandage change and then at your suture removal. We'll remind you of these things. We're always here if you have any questions, so feel free to reach out.